Contact tracing and quarantine protocols are back in South Africa. It comes after the Health Department yesterday backtracked on the decision to halt them earlier this month. For reaction on this, I'm joined by Dr. Tetteh, a medical doctor and African health expert in Ghana. Dr. Tetteh, very good morning to you. Thank you for your time. What's your reaction to this decision?
Good morning, and thank you for having me. Well, I remember I was on a bit earlier this week. I was asked about it, and I stated that my position would be that they keep the contact trace, and that's my preferred position. So I'm actually happy that they are now going back to the contact tracing and quarantine. I'm actually happy.
What do you think are some of the very crucial benefits of instilling and ensuring that the system continues to contact trace and allow for quarantine to occur?
So that's very important because we know how COVID-19 is spread, mostly by contact. And so you may come into contact with somebody who may have symptoms and you may be asymptomatic. So for the person who has symptoms, the person would go to the clinic and would be diagnosed of COVID-19. But if there's no contact tracing and you have no symptoms, then you can walk about, although you have the virus, and continue to spread it around to people. But when there's contact tracing, the person reaches out to you, you come to the hospital, you are tested, and then you're put into quarantine or self-isolation. And then you are saving more people from getting the virus and then reducing the numbers. So contact tracing is very important.
The government had initially suspended this move because they believe that most of the population had already been exposed to the virus through either vaccination or infection before making this decision. I mean, how much merit do you think that argument had before this decision to reverse it was made?
Well, I think that to be fair to the government, I read that they also mentioned economic challenges as well, which is very normal because COVID-19 comes with a lot of financial difficulty. For us, when you call me, I'll speak as a health expert and I'll say, okay, do contact tracing, okay, do quarantine. But for the government and the leaders, they're looking at the totality of everything. So if we are keeping people here, if we're not making them work, if we're making them have a lockdown or all the other restrictions, what's going to be the economic challenge on us? And so that's the basis for which some governments have made certain decisions. But the good thing is that at least when they realize that, no, there are lots of complaints, it's not going to work as much as we thought, and then they go back on it, that's the good thing. That's what I believe personally.
You speak about the economic damage and the shortfall, which of course has affected the world over. Perhaps the impact even more detrimental across Africa as a continent. What sort of impact has COVID-19 had in Ghana? Because we know that a cash injection was recently received of about 82.5 million as a COVID-19 support grant.
So COVID-19 has had an impact on every nation, because then even with the vaccination, when you receive free vaccination, there has to be a lot of education. Money has to be injected into education. Then there has to be allocation of resources. You need to get transportation to the places where the vaccination is going to be held. You need to educate people. You need to pay people to do the vaccination as well. And then now we have to provide PPE, so the personal protective equipment. That's used like on a daily basis. Look at the number of masks that are used, number of gloves that are used. And so COVID-19 comes with a lot of economic challenges. And so yes, the money is good, but you realize that the money is going into avenues that are very difficult to account for because somebody can use 5 or 6 masks in a day, and you can't ask the person, why are you using 6 masks in a day, or why have you changed your personal protective equipment 3 or 4 times in a day? It may be necessary, it may be required. And so yes, in as much as we're getting financial support, just as in other countries, the money is being channeled into avenues because COVID-19 has in itself come with a lot of economic challenges and financial demands.
We know that as we assess the continent, over 9.5 million cases of COVID-19 have been confirmed across Africa in its on just Africa alone. And that, of course, raises many concerns. I mean, right at the beginning of COVID-19, access to vaccinations was a major, major concern. Where do you think we're standing now as a continent in the fight against the COVID-19, and perhaps some of the contingency measures that we need to continue to keep in place?
Well, I think we've relaxed a bit. We relaxed because of our religious beliefs. Some people believed that there was more religious association to COVID-19 than to this. We realized because of our cultural beliefs. Some people believed that it wasn't a black thing. And I think that with all of this relaxation and the misinformation that we believed, and the fact that we're deeply rooted in our belief systems, we didn't take COVID-19 too seriously. The other thing is that we're moving about so much. Africans, because of our economic woes, you can't ask people to stay at home. You can't really lock down because then the government would say they don't have the money or the financial capacity to take care of the people who have been locked down, to provide food for them. Most Africans live from hand to mouth, so they need to go out, sell their goods, provide their services outside before they are able to make something to eat. And so because of all these things and the way our system is structured, and of course, looking at the way our health system is, we didn't take too much precaution or weren't too serious with it. Or we also didn't believe that we're going to get affected as we compared our numbers to the numbers of the Westerners, because a lot of people were dying as compared to us, and we seem to be recovering much more than them. And so I think that we relaxed a bit, and that's why now we are having an increase in the numbers because we have relaxed. And with the vaccination in itself, there are people who are not taking it, of course, because of our belief systems as well. And so all of these pose as challenges. I think what we can do is continue with the education, continue to let people know that vaccines are good, the vaccines are safe, at least it reduces your risk of complication from the virus, even if you can get reinfected. We also need to reach out more to donor agencies, international bodies, so they can help us with more money, more vaccines. And we also need to be ready when the vaccines come, because there have been vaccines have reached countries, and these countries were not ready to receive the vaccines or to distribute them. And so it was close to expiry. They had to send it to other countries, or even in some countries, it's expired there. And so we need to make sure that we are ready for the help that we are asking for. So I think that these, in addition to the precautions, contact tracing, social distancing, self-quarantine, self-isolation, I think all these things would help us so that we don't get to as large the numbers in deaths and cases as other countries are experiencing.
You make mention of cultural beliefs and the impact that has had on the fight against COVID-19. We know that right at the beginning, when COVID-19 first started, there was a lot of confusion on some of the medicinal measures. I mean, African indigenous medication and the use of medicines like the Artemisia. As an African health expert, where are we standing now in that discussion about some of the ways in which one can treat the symptoms of COVID-19 through African medicine?
Okay, so I think that the best African medicine is our food, really. I think that we grow a lot of our food naturally, and so when we go to the farms, we should go to the farms, get the organic, the actual food from the ground. Make sure we're eating a lot of fruits and vegetables. Make sure that we're drinking a lot of water. And the challenge with us as Africans is that when we come out with a drug and we're asked to prove it, then there's difficulty. So if you're unable to prove your drug or to prove that it has worked on these number of people, it makes it difficult to be accepted internationally. And we don't understand why our drugs are not accepted internationally. But if you're not able to prove beyond doubt that it's not going to be harmful to people, it makes it difficult to accept. So I think that in as much as we are adding our fruits and our vegetables, which we are lucky to have, because you can go to the farms and actually grow them and be sure that we're getting all the right nutrients from them. We should also make efforts to ensure that whatever we come up with, whatever drug we come up with, we're able to prove beyond doubt that this drug has worked on these number of people with no side effects. Another challenge with Africans is that we don't actually have the measurement. So you see that we have these number of leaves, and in some ingredients they say 5 leaves of this and maybe a handful of this. We don't have the actual measurements, and so it's difficult for another person to replicate what one person has done. We also don't like to share our ideas, and so if I believe that I've had the cure for COVID-19? Am I willing to share with my African partners so that together we can work? We should also be ready for suggestions and additions. I think that's our challenge as well. When we come up with something, we want it to be accepted through and through. We don't want any addition. We don't want any correction. So I think that in as much as we are trying, we need to position ourselves to be also ready for criticisms in this regard. And then that way the African medicine would start stronger and then we will be taken more seriously, if I should say.
Very well, absolutely. Thank you so much for weighing in on that discussion, Dr. Hannah Lisa Tetteh, medical doctor and African health expert, just really talking to the continent's response to COVID-19 and some of the decisions that have been made, especially here in South Africa, where the health department has reversed the COVID-19 contact tracing decision, getting that response.